Welcome back to your Health Facts podcast.
Mm.
Today we're talking about recognizing those subtle signs that our bodies might be trying to send us early cancer detection. We're not medical professionals,
Of course.
but we've gathered some pretty fascinating information
Yeah.
about potential symptoms that you might not expect. Remember, this is for informational purposes only, and always consult with a healthcare professional
Always, yeah.
for any concerns.
Right. So to jump right in, let's start with something that you might not immediately associate with cancer. Eye pain. Most people think of vision changes, blurry vision.
Right.
But persistent pain, blurred vision, or even those flashes of light that kind of look like lightning bolts, even if it's a sunny day, those can be red flags for ocular melanoma. And this is a rare cancer that develops in the eye. Catching it early is key, so don't brush off any unusual eye symptoms.
I always thought bone pain was just part of getting older, but it turns out deep, persistent bone pain, especially if it's worse at night and doesn't respond to over-the-counter painkillers, can be a sign of something more serious, potentially bone cancers or even cancers that have spread from other parts of the body. If you're experiencing this kind of pain, definitely don't just dismiss it as age-related aches.
Yeah, and here's another one that might surprise you. Jaundice. We all know it as that yellowing of the skin and the eyes, and while it's often associated with liver issues, it can actually be a sign of pancreatic cancer as well.
Interesting.
What's really alarming is that in some cases, jaundice is the very first noticeable symptom.
Wow.
So if you or someone you know develops jaundice really out of the blue, it's crucial to get medical attention immediately.
Now let's talk about fever.
Yeah.
We all get fevers from time to time, but
Ow.
a persistent fever that lasts for weeks or keeps coming back, especially with night sweats, unexplained weight loss, and fatigue,
Yeah.
that's a different story. These could be signs of blood cancers like leukemia or lymphoma,
Right.
and they require prompt medical attention. It's important to differentiate these red flags from the typical fever you might get with a cold or flu.
Exactly. Yeah. And then moving on to something we all experience occasionally, difficulty swallowing. We've all had that feeling of, when food gets stuck.
Yeah.
But if it's persistent, getting worse over time, and doesn't improve with those over-the-counter heartburn remedies, it's worth paying attention to. This can be a sign of esophageal cancer, and early detection makes a huge difference in treatment options.
Speaking of heartburn, did you know that chronic acid reflux, the kind that just won't quit, can actually increase your risk of developing cancer?
Yeah.
It's because that constant backwash of stomach acid can damage the lining of your esophagus over time, leading to a condition called Barrett's esophagus, which is a precancerous condition.
Yeah.
If you're dealing with ongoing heartburn, especially if you're also having trouble swallowing or losing weight without trying, definitely talk to your doctor.
Yeah, all these things that we think are just kind of everyday annoyances can sometimes be a little bit more serious, so it's always worth getting checked out just in case. Now let's take a look at our nails. We often overlook them, but they can actually provide some valuable clues about our health. Specifically, dark vertical streaks beneath the nail that don't grow out with the nail could be a sign of a rare but serious skin cancer called subungual melanoma. These streaks often appear suddenly and might change in appearance, unlike typical nail discoloration from an injury or fungus.
Yeah.
So if you notice anything like this, it's best to get it checked out by a dermatologist.
Here's another skin-related symptom that you might not expect. Tiny red or purple spots that look like pinpricks and don't fade when you press on them. These are called petechiae, and they can be a sign of leukemia. These spots occur because of low platelet counts, which can be a hallmark of this type of blood cancer. Often they'll appear along with other symptoms like unexplained bruising, frequent nosebleeds, fatigue, or infections that just don't seem to go away.
Right.
So those are all things to watch out for.
Yeah, and finally, let's talk about something that might seem completely unrelated to cancer. Iron deficiency anemia. Okay.
Now, this is more common in women, but if a man or a postmenopausal woman suddenly develops iron deficiency anemia, it can be a sign of something more serious, like colon cancer. This is because bleeding from tumors in the colon can lead to slow, chronic blood loss, eventually resulting in iron deficiency.
Wow.
If you're experiencing unusual fatigue, weakness, pale skin, shortness of breath, and your doctor finds that you have iron deficiency anemia, it's important to investigate the cause. So we've talked about some internal signs, but now let's kind of shift our focus to what you might notice on the outside.
Okay.
Starting with your skin. Skin changes can also be harmless, but there are a few things to keep an eye on. One is a sore that just doesn't heal. We all get cuts and scrapes, but if you have a sore that just lingers for weeks or even months and doesn't show any signs of healing, it's worth getting checked out.
Yeah, that makes sense.
This could be a sign of skin cancer, especially if the sore is also changing in size, shape, or color.
Another skin change to be aware of is any new or changing moles.
Oh, yeah, absolutely. Most moles are harmless, but it's important to be vigilant about any changes in their appearance.
Yeah.
Keep an eye out for moles that grow larger, change color, develop irregular borders, become asymmetrical, or start to bleed or itch. These changes could indicate melanoma, a serious type of skin cancer. And it's always best to err on the side of caution and get any suspicious moles examined by a dermatologist.
Always better to be safe than sorry.
Exactly.
Moving on from the skin, let's talk about something that many women might experience at some point, unusual vaginal bleeding.
Okay.
While some spotting between periods can be normal, especially if you're on certain types of birth control,
Right.
bleeding that's heavy, prolonged, or occurs after menopause could be a sign of endometrial cancer, which affects the lining of the uterus. So if you're experiencing any unusual vaginal bleeding, it's essential to consult with your gynecologist to determine the cause.
And for men, let's talk about a topic that often carries a stigma. Breast changes.
Yeah, that's an important one.
While breast cancer is far more common in women, men can develop it too. It's crucial for men to be aware of any changes in their breast tissue, such as lumps, swelling skin, dimpling nipple retraction, or discharge. These changes should be reported to a doctor promptly for further evaluation.
Absolutely. Now let's talk about a symptom that might seem completely unrelated to cancer.
Yeah.
Coughing.
Okay.
We all cough from time to time.
That's cool.
But a persistent cough that just won't go away, especially if it's accompanied by coughing up blood or mucus, could be a sign of lung cancer. Of course, there are many other causes of a persistent cough, such as allergies, infections, or asthma, but it's important to rule out any serious conditions, especially if you're a smoker or have a family history of lung cancer.
Another symptom that can be easily dismissed is hoarseness, or a change in your voice.
Yeah, you just think you've got a cold.
Exactly. We all get laryngitis from time to time, which causes temporary hoarseness. But if you experience hoarseness that lasts for more than a couple of weeks and isn't related to a cold or other obvious cause, it's worth getting checked out. Persistent hoarseness could be a sign of throat cancer, especially if it's accompanied by other symptoms like difficulty swallowing or a lump in your neck.
And then urinary changes can also be a red flag.
Okay.
And we're not talking about the occasional urge to go more frequently,
Right.
but rather persistent changes in your urinary habits. These could include needing to urinate more often, especially at night, having a weak urine stream, experiencing pain or burning during urination, or noticing blood in your urine.
Wow.
While these symptoms can be caused by other conditions like urinary tract infections or prostate problems, they can also be a sign of bladder cancer or kidney cancer. So it's important to seek medical advice if you experience any persistent urinary changes.
And sometimes the signs aren't so specific.
Right.
You might just feel off in general.
Yeah, like something's not quite right.
Exactly.
Yeah.
Maybe you're experiencing unexplained fatigue that doesn't improve with rest, or you've lost your appetite and are unintentionally losing weight. Perhaps you're feeling bloated or have abdominal discomfort that just won't go away. These vague symptoms can be tricky, but they're your body's way of telling you that something's not right. If you're experiencing any persistent unexplained symptoms that are causing you concern, it's always best to consult with your doctor.
I think that's a really important point. You know, we tend to ignore these little things, but sometimes those little things can be really significant.
Right. It's about listening to your body.
Exactly. You are your own best advocate when it comes to your health. Pay attention to any changes, no matter how small they might seem. Early detection is often key to successful cancer treatment. So don't hesitate to seek medical advice if you notice anything unusual or concerning.
It's important to remember that experiencing any of these symptoms doesn't automatically mean you have cancer.
Right.
Many of these symptoms can be caused by other, less serious conditions.
Exactly.
However, it's crucial to consult with a healthcare professional if you notice any persistent or concerning changes in your body.
Yeah, I mean, it's always best to err on the side of caution.
Right, early detection is key.
Absolutely. Early detection plays a vital role in cancer treatment and outcomes. When cancer is found early, it's often more treatable with better chances of successful recovery.
That's so important.
So regular checkups, screenings, and self-exams are essential for staying proactive about your health.
Remember, knowledge is power when it comes to your health.
Absolutely.
We encourage you to stay informed about potential cancer symptoms and discuss any concerns with your doctor.
Yeah, and don't be afraid to ask questions.
Right. Your health is your priority.
Exactly. And for more insightful information on health and wellness, you can visit yourhealthfacts.com and subscribe to stay updated.
That's yourhealthfacts.com. Thanks for joining us today.
Thanks for having me.